Oh, hello, everybody. Just want to jump on here live a little bit and talk about one of my favorite subjects, how uh, we can come in and help you make your treatment plan work outside your walls. Um, my name is Rich Jones, and I represent secondstarts.com. And our whole thing is trying to make you understand and help you guys teach your client families, how to manage, build, manage, evaluate their support networks. In our opinion, it's overlooked. I think it's a gap in treatment, a big gap, and it's overlooked. I know a lot of times we have people to go out and help family members and talk to them about this, that, or the other. But what we're talking about is taking that whole family support network, and not just family, but everyone who's in a support network, and building it into a unit. Okay, that pulls in the same direction and sees things differently. And the most important part about it is doing it without the shame and guilt factors that we normally find in most of our processes. Uh, Second starts, and this program is strictly non clinical. I did this on purpose. I've been an RN for 40 years. I did this on purpose because I wanted to let every uh, frontline practitioner and all the resources that they use, whether it be psychological services, social services, any of the other type of services or referrals that you might make, our system works along with it. We are what I call a force multiplier. What we do is we take a support network, we reorganize it. Okay, we give it focus. The whole network, we give it focus. Okay, we give it strategy. We give it outcomes that they can base, you know, their the subject client's progress on, and we don't involve any of the other strategies or uh, practices that any of the professionals would use. This is strictly non-professional. We use a number of different types of systems, which I want to talk about a little bit here, in order to increase that value of the actual support network. Okay. And I think that's important. So, as you see, we wrote down here strengthen compliance, reduce relapse risk, and stabilize outcomes by fixing the family system that surrounds your patient. So, this is not a service that you, comes to you and we're asking you to buy anything. It's basically a referral service, and we offer our services to families and give them a different way to see how they can help instead of the standard way. We give them something else to work with, again, as a force multiplier in what you're already doing. We firmly believe that most treatment plans don't fail because of clinical quality. I have a high regard for clinical quality in this country. I'm one of the people who don't really have a complaint about our medical system. It doesn't work perfectly, but then again, none of us and it shouldn't work perfectly. We're not perfect. It's moved as a group. Sometimes it's a little clumsy. Sometimes it's a little wrong-headed, but that's how we move as people. So I like to accept that and look at our clinical situations, our practitioners, as maybe imperfect, but definitely well-meaning and the best trained in the world. So we are here basically to give that system all the help that we can get. It's my opinion that uh, the family support system is well overlooked in its strength in order to create outcomes. We sort of try to treat despite the family system instead of with the family system. And that's understandable. The family system is fraught with love and support, also a lot of challenges, a lot of challenges, a lot of personal dynamics that while, with the help of some of your other practitioners, those things can be helped and made better and, help the environment for the subject client, work a lot better and help them. There's also a lot of detrimental things involved in the network. So what we try to do is give that network a total different focus, okay, and a different mindset and a different game plan in order to create a positive environment for the people that you are working with. So that's what we're doing because, and we write down that we proactively address the family and environmental factors that quietly undermine progress. I wrote down quietly, but sometimes it's not that quiet. A lot of times it doesn't, a lot of times it's you, it's the destruction that you don't see, that support system. That's the destruction you don't see. You see non-compliance. And sometimes you understand that there's problems, but you don't understand exactly how it's working. And you may never will personally understand it. But what we try to do is go in and give that family unit a completely different focus. I want to talk about my story real quick so you understand who I am and why I'm doing this. Um, my name is Rich Jones. Been a nurse for roughly 40 years. One of the things that bothered me so much when I entered into nursing, I entered into long term care and stayed there for about 10 years. Accidentally, uh, I ended up being introduced into the correctional system just by happenstance. You know, nothing I looked for. At the time, I didn't even actually know that nurses were in the correctional system. I never thought about it. I was introduced quickly into that and started off in a director of nurses position, starting off. So I was totally in the weeds with the help of a lot of good LPNs. I was introduced and taught how to live, work, and help in the correctional system. But in that in that story, I started from ground zero, and I didn't even understand the environment that I was working with. I was used to geriatrics, uh, and I'm not never was a big inner city guy, so I didn't really understand a lot of the things that were going on and a lot of the people that I was dealing with. You know, I learned quickly, but I didn't know. I understood the family relationships between them, but I didn't understand their their stories. So as I learned that, I learned quickly what I thought was bothering me with the system. And it wasn't the normal things that everybody thought was wrong with the system. I understood that there was a lack of resources. You know, it seemed that the system didn't care. It seemed like we were working with people who didn't want to be helped, many of them. But I saw it in a different way. I saw it in a way that gave me um, three different views of it simultaneously because as that nursing director, I was used to putting systems and packages together in order to get help. So I saw it as a amalgamation of three things. The first thing I saw is my practitioners. I saw great practitioners working. Uh, and it wasn't because they were getting the greatest results. I just knew that their approaches were sound. I knew that they cared. I knew that they were prone to burnout in those situations. I think the way I described this ice skating uphill, you know, a lot of times it was a no-win situation. It was short term. There was no chance for follow-up. We're basically going through the motions, but they were putting their effort into those motions. And I respected them for that. And I thought to myself, there was got to be a way that we could tee the ball up a little easier for them. You know, set that target, set that the people that were helping them, give them a better chance. I knew that actually in that correctional facility system, it was going to be difficult because we had a captive audience, but we didn't really have access to all the systems that we use. But I still, in my mind, I wanted to see what could I possibly think of sort of in a nursing vein, not in a not trying to take a practitioner's place or tell them how to do their job, but in a nursing vein, what could we do to make it easier for them? As I thought of in my entire nursing career, what can I do to make systems work better and help people more take advantage of their access to care? So the practitioners were, I was worried about them and I wanted them to do better. Second was I unfortunately had to absorb a lot of you know family pain and pain between our some of the young inmates and their families and the levels of embarrassment, levels of dysfunction in the family, um, the levels of shame, um, the levels of you know feeling hopelessness, and I wanted to be able to do something that could lighten that burden for a family and give them a different way of looking at it. But I knew that, again, it wasn't my business or my uh, in my scope to go in there and work with them psychologically. So what could I do to make this easier on them? And that was on my mind. What could I do to help those families? That pain, it wore me for a long time, up until the part where I uh, finally retired, and I really needed to work on this and see what could I do. Okay. My third big why was some of the young adults that I was running into in the jail. A lot of the people, but the young adults, just so much wasted talent, uh, ability that was right behind the pain, right behind the lack of access, standing right behind the dysfunction that they were thrown into. And I understood that we could eventually always put the blame back on them, and which is what we did. If they don't want to act right, we can, lead a horse to water, but we can't make them drink. But I understood that there had to be a way where we could unlock and meld our potential, their potential, in with what these frontline practitioners were doing for them, and give them a chance to absorb, if not just 25 or 30 more percent. I thought that that could do a lot to raise the level of what we were doing. So those three things was really turned out to why I wanted to, you know, work and provide and help deliver a system that could help practitioners and practices, and and the body helpers. And that's just not just professionals, but also the volunteers. I wanted to be able to step in and help volunteers. And I wanted to create a system that helped them all at the same time. It was a big undertaking, but I think we got there. uh, the first thing I thought about was our lack of urgency. I really did think there was a lack of urgency. There was a lack of, well, this is the way it has to be, and this is the way it's going to be. And, even though the practitioners worked their best in the individual situations, the entire system itself had a lack of urgency. And I thought that if I could get to frontline practitioners and get them to just do a couple of things differently, I thought that we could make really big, big headwinds into what we were trying to accomplish. And that was, raise the level of our compliance, raise the level of, the results, raise the level of the professions. You know, First thing I wanted to do was, where we found cases that were obvious risks, start early. Assume that it's going to be a lot of problems. Let's assume. Let's not wait. Let's assume that we can get in and help bring a family together and create focus in a support network. Okay, because it's not unusual at all for families to be unsure of how to support without enabling. It's just difficult. And quick lectures do not really necessarily change that, and certainly not in time. Okay. Uh, for certain individuals or certain situations, or, there was always a history of stalled progress or repeated setbacks. And you basically knew who and where and what you were dealing with when you saw it. It's very difficult for practitioners to admit that to themselves, because they go in obviously looking to do their best and treat everyone the same. But I think we got to recognize that there's certain situations that are um, fraught with roadblocks, we might say. Okay, situations with low follow through and low follow through outside of our structured setting. So even if we could get something going part time or short time, we had no way of keeping it going, and that was important to me. What could we do to keep going? You know, and just anything that we wanted to do to combat that the friction of the real world, because that was the biggest thing. This is a people business, and when we ignore the people in it, when I mean just the people, not just the subject client, but the individuals that they live with, see, think with, learn from, that all had to be treated in one unit. And I thought that was important. So again, what does restorative life management actually do? Okay. And what it is an installation. Okay. It's a non-clinical system. Okay. That runs alongside of treatment plans and alongside of health. It runs alongside of, like I say, primary practitioners, uh, augmented practitioners, volunteer staff in situations. It runs alongside and builds up that strength of attention and absorption and organization. It runs along with that. Okay, it's a dual track system We find that very interesting that we don't try to get everybody in a room and teach them all the same thing at the same time. That's to me, that's one of the biggest creators of guilt and shame. Everyone can't sit and do the same thing in this team. Okay. You can have some people to do it, but the support network has to take on a different role, not the same old role where they sit around and hear about how the person's doing and oh, they're going to do better and they forgive you. And that there's a place for that. Our psychological practitioners, our social practitioners can and will handle that. But this is a boost in a dual track system. In the first track, okay, it builds a prompt and response accountability system, okay, that trains follow through and a self generated drive. Very important. Self generated drive. Not a healing, but a self generated drive. Very important. Okay. The family track, you transform the support network into a clear, guilt free, blame free structure that reinforces progress. I want to repeat that. It reinforces progress. It doesn't deal with the setbacks and the downfalls of the disease process um, or the social action progress. It doesn't deal with that. So when we can eliminate that part of it, we can focus now on achievement. Okay. We can focus on outcomes. Okay. I think that your clinical work would be much better understood and applied and sustained in the real life atmosphere if we can change that focus of the support network. I think it'll be huge because it's very difficult for no matter what treatments you're offering, no matter what suggestions you're giving, no matter what assets you are putting in front of them, if they don't have what they feel inside is the complete respect and support of a well-groomed support network, then you're working against everything. Okay, very important. So for me, um, I had to come up with three missions of intent, three desired ways we wanted to approach this. And I came up with three things, three areas that I thought really encompassed what we needed to do. These three things, too, similarly, had to be done simultaneously. It was very important to me to do them at the same time so they could bring to a head all our assets and all our focus. So, first thing we'll go over them in a bit here therapeutic comprehension, support network, and the self refueling transformation. Now, what does therapeutic network? I mean, therapeutic comprehension. When I said therapeutic comprehension, basically I mean is all the assets that are brought to bear and to help. That is obviously starting with the frontline practitioners, moving down to the people that you refer, whether it be social service, psychological services, um, all the different services that you do to reinforce the main plan of treatment. All of that it was like a colander or a bucket with holes in it. No matter what you did, that because that family structure had holes in it, everything you do leaks out also. Okay, so we need to shore that bottom up with that family structure so that we can now bring attention to the assets that have been already delivered. Okay, and we can create a new focus around the assets. Okay, take an inventory of the assets, see how they work, see what their value is, and really take time to get the individual understanding who and what were the things that they had working for them and how could we best position those things in order to help get the outcome that they desired. Very important. What the outcome that they desire, what they could see for themselves. Okay. We wanted the support network enhancement. This is the main thing that I was trying to do is change that support network, change how they saw themselves and what they thought their mission was, and give them a way to support without judgment. And just saying support, just telling them to support without judgment is not enough. You have to give them a mechanism and a methodology and a system to support without judgment. Because when we can do that, we can start changing that focus again. Once we change that focus, now we're starting to shore up and keep and better absorb those attributes that you are trying to deliver, the treatments, the therapies, and the counseling. That's what you're trying to do, and you're trying to get them to absorb it more and have it stick with them more. That's what we are trying to do, and we support that network enhancement and build that new network and show them how to evaluate, how to build it, how to treasure it, how to grow it properly, not just any old who. Very important. And of course, the self-refueling transformation. No change, okay, can come about unless there is ability for the individual, the subject client, in order to refurbish that power, okay, and continually refuel that tank with energy in order to continue to go. This is the problem that we have with rehabs. It's not self, it's not a transformation that is self-refueling. So we teach the individual how to refuel their own power and their own strength and their own direction. Okay. To now again continue to take better advantage of the things that you are doing as frontline practitioners. I hope you understand where we're going with this. We're looking to strengthen this on all three sides. Very important. One of the things that's important about a self-refueling transformation is that there are certain ways to install it. And with our restorative life management program, I'll go on that before we go into this clinical boundaries. With a restorative life management program, we take those three things. We understand that there is the ability or the need for us to create an internal habit, okay, that use external accountability to create an internal habit. Because once we can do that, we can get the individual now working toward helping themselves. Just saying it, just doesn't do it. And this is why I think we lose so many. We have great advice, but we're not following it through. They say, well, you can't take their hands and make them do it. I disagree. You can help them with strong habit building skills and direction. Once that strong habit is installed with direction, self-chosen direction, you can have something that can really start to work. Some of the things that I really knew that were important was direction. We needed to focus more on direction. We need to focus more on giving that individual something to shoot for and ways to put those in place. It didn't. One of the things that causes a lot of failure is telling someone what they've got to do and then directing them toward it and hoping they stick with it. What we need to do is get them in that process of developing those directions so that once they're internalized and created by them, they are much more easy to follow and easy to stay with. It has to be a customized approach. No one's the same. And cookie cutter approaches do not work. Getting groups of people in rooms does not work. And I understand that the system depends on doing many people at the same time. But with restorative life management approach, we isolate and work with that one individual and that one family unit, and we work just for them. And we build a system around them. And that's very important. We build a system around them. There were certain things that each and every person and support network had a problem with. And we broke them down into 4 things to make it a lot easier for the installation. Okay, agency and ownership. There's obviously a problem with agency and ownership anytime there's self-help being done. It's as simple as that. Communication, organization and planning, and preparation for real life friction. Once we could pull those things together, we had a mechanism now that could go in and support what you were doing clinically. That was important, to support what you were doing clinically. There's nothing more important than that. And if I get you to respond to this, I really like to go into with you what the restorative life management program, actually how it's built and why it will help. We won't do that on this slide because it could be a little timely, but you'll understand it when it comes into place. Very important to me again, and we talked about this, was the boundaries. Boundaries were so important to me. I wanted to get out there and help, but there's no way we could get in there and help clinicians and frontline practitioners if we were pretending to do their job. We're not educated to do their job. We don't have the expertise to do their job. But As a nurse of 40 years, I sure understood what I could do to help make their jobs easier, facilitate better compliance, you know, help the individuals working in their system with their focus, their organization, their strategy. And I thought that was extremely important. So, no therapy or medical services. That's not what it is. Totally non-clinical. Okay. It does not interfere with your treatment plans at all. And it does not replace any particular level of care. It is built to be installed to aid in each and every level of care. Okay. Uh, there are possibilities and those are personal possibilities when in fact we've had certain frontline practitioners and certain families want to involve some of their care plan inside of this. It can be done, but it's not necessary. Okay. Why does it work? Okay. First of all, it closes that gap between treatment and real life situations. That's essential. Okay. Real life, has a form all its own. And that's why we had to be customized because until you can customize your actual plan with that individual's real life situations and have them make that close association, you're obviously, again, ice skating uphill. Okay. We reduce the family driven setbacks and friction, which there are many, just by changing the focus of how the network creates itself and what it does. We change the total focus of it. Okay. Uh, we can help create sustainable compliance and not temporary motivation. This is a lifetime management system that we're installing. I use the word installation because it does not, this is not uh, just go on and on. Okay. This is not the type of therapy that you may use. Understand that some of your clinical management may have to go on for undetermined amount of time until you can get the desired outcome. But this installation of this framework is not that. It is built specifically to build long term independence, okay, from the external structures. And that's most important. And most of all, I wanted to create something that could help, but I wanted it to be financially fair. The way it is delivered in a piece by piece as you go momentum in order to make sure that no part of the system is left behind. We move slowly and we move all together. We move as a unit. And not until in each and every section is the client, subject client, and the family totally on board and felt like they have been totally served, do we move on? Okay, there is no such thing as dissatisfaction in the system. We either get the installation or we don't, but there's no dissatisfaction with services because we move slowly, making sure that we gather strengths and insight. And that's very important. So for 40 years, with this information that I've gathered and I put together, again, our goal is to augment and help um, the situations closely. I want to go back to what we've said, and this is what we're putting in our post. I hope to get you to understand. Um, the question is, who is helping your client families learn to properly evaluate, build, and manage their support networks in a guilt-free and shame-free way that prepares them to absorb and benefit from your treatment, your therapy, and your counseling? That's exactly what we are here. Uh, we want to give them what we call a real world navigational experience for the patients, the families, and the clinical system. That's most important. You can reach me at Richard Jones at secondstarts.com or go by secondstarts.com. Thank you.